There were general nurses. I met 3 of them. I was selling light and then Zunkom at the forest. So I met about 3 guys. They were taking wee and ashes. I met a guy too who is addicted to pethidine. He has to be, before you see the guy mingling normal with others, he has to take pethidine before.
Yes, I have come in contact with a medical doctor that has gone under a narcotic addiction last year.
Other patients from other backgrounds like the banking sector and some students, some those who do corporate works.
When I take it, I get high. And I'm able to sleep. But I sleep for a while. Once the medication wears off, you are up again. That's the feeling about it. And usually I start with one. It got to a time I had to take more, double up the dosage to get the same high I needed.
Monica was a shining star in the nursing profession. For over 20 years, she was the one midwife everyone looked up to. After the loss of her mother, she felt all alone.
I became addicted to pethidine. That was 3 years ago. But before then, I went through a lot of different things. I had my first surgery. And then the same year, I lost my mother.
With pressure also mounting from work coupled with abdominal pain, she started self-medicating with pethidine to cope with her stress. Soon, she used the cover of her nursing profession to purchase more pethidine without prescription.
Pethidine is expensive. And once you have money and you can buy, people sell it to you without necessarily having the prescription signed by a doctor to buy. So that's how I was getting my pethidine. I go to pharmacists and I get it. Not within the hospital environment, no. Not where I work. I just go to any pharmacy and I get it.
Her colleagues soon suspected her of drug addiction and reported her to high authorities.
They actually went to my boss and told my boss about it. So she called me and suggested rehab. But at the time she suggested, I didn't think I was addicted, so I refused.
After months of being addicted to pethidine, she made a bold decision after contemplating suicide to seek help.
It took me 1 year to decide that I was really addicted to pethidine, and even that, I realized I couldn't take care of myself. I had lost so much weight. And then on my birthday, I nearly hanged myself in my room. And the only thing that changed the suicidal thoughts was the fact that I thought of my son lying in the next room. That's the only thing that made me seek help.
Pethidine is an opioid pain relief medicine used for various conditions. Due to the fast-acting effects of pethidine, patients can experience feelings of euphoria. The euphoric side effects increase the addiction potential of the medication. Pethidine is not recommended for patients with chronic pain. Pethidine is considered highly addictive, and so it is not prescribed on an ongoing basis or the treatment of persistent pain in chronic conditions. President of the Ghana Registered Nurses and Midwives Association, Perpetual Ofori, was deeply saddened by Monica's story.
So it's been there like forever. When I was in training in the 90s, we knew that there were doctors that were addicted to pethidine. There were nurses that were addicted to pethidine. I have not used it before, so I don't know what they get from it when they take it. But these are medical drugs that are used for specific things in terms of the care we give to our patients.
She says there are an unknown number of nurses who struggle with addiction, with some losing their lives as a result.
In quite recent times, we've lost a couple of nurses who, of course, were identified to be using them, but they go through some kind of rehab, they go back, they are taking it, and suicides and death that cannot be explained.
She wants improved counseling and support systems for health workers who suffer from substance abuse.
We will have to enhance our education, our sensitization, more to do with early identification of such abuse and finding ways and means to help these individuals through psychological support.
Studies have found healthcare workers who steal drugs tamper with medication, leaving them contaminated. A study in the US by Mayo Clinic found more than 28,000 hospital patients were put at risk of contracting hepatitis C over a 10-year period because of this kind of drug diversion. Perpetual says management of various health facilities should detect and report drug thefts. Drug disappearances have been uncovered in hospitals across the nation. This has got several healthcare experts worried. Doctors, nurses, and other healthcare workers are suspected of misusing and diverting higher-risk medications from the in-hospital supply, leaving many hospitals ill-equipped to combat the problem. But how can one overcome such addictions? Harriet, a drug addict counselor, has been helping hundreds of addicts overcome their addiction.
Drug addiction is with us. It's in every aspect of our lives. The problem of addiction is everywhere.
She explains why individuals get into the use of drugs in the first place.
For her, it was just a grieving process. For others, just stress from daily living, just the stress. Others also fun, just want to have fun, and so then it begins from there. And others, curiosity, especially with the youth. I'm just curious about this, and so I start. And before you realize, you are becoming addicted to whatever it is you were using.
Monica has undergone rehabilitation for 4 months and has since been drug-free, and continues her nursing profession with a Catholic facility. Stigma and fear are preventing many healthcare workers from seeking help for addiction before it's too late for both themselves and their patients. Now, desperate to hide their illness, healthcare workers are suffering in silence, and the lives of those who they take care of are at risk. This is according to experts we interviewed here in Accra. They say the fear of being fired or arrested for drug abuse is preventing addiction help from being sought in a timely fashion, leading to tragedy for many.
I think addiction is everywhere, in all sectors. Everywhere, addiction is there. But you see, because of the stigmatization, people are not ready to come out and seek help. Not only that, by the time you become addicted, you don't have money to even fend for yourself, let alone say, okay, now I'm ready, I need this help. Where do you get the money to pay for the rehabilitation? That is the problem.
It is our duty to open the conversation and provide support to those who are suffering in silence. We must break the stigma associated with addiction and work to provide the help and compassion that all individuals deserve. Emmanuel Samani, TV3 News, Pantime, Accra.